This is Outbreak News This Week, brought to you by the Global Dispatch Incorporated. Outbreak News This Week is your source for all the news about worms and germs. And now, your host, microbiologist and editor of OutbreakNewsToday.com. Here's Robert Harriman.
Well, good day, Tampa Bay, and thank you for listening again to your source for all the news about worms and germs. And those of you watching on Facebook Live, I appreciate you watching, and I encourage you to bring on questions and comments or anything you got concerning the world of infectious diseases and outbreaks, and we can chat about it a little bit. I want to go ahead and start out the show with some local news. I'm in Central Florida, and there's a hepatitis A outbreak going on in the state of Florida. And I just want to give you the latest update that's going on right here in the Sunshine State. Not too sunny today, though. It is kind of rainy today. But we have eclipsed the 1,500 case mark with hepatitis A since the beginning of last year. So last week, Florida health officials saw another 70 cases. And we're nearly 1,000 just for the first 4 months of 2019. And this little area here, the Tampa Bay area, has been hit by far the hardest, right? We got Pinellas County, who's seen well over 300 cases. Pasco is number 2 in the state, and Hillsborough is number 4 in the state. So if you include Orange County in the center of the state, you're talking about more than 60% of all the cases just in those 4 counties. So yeah, it's a big deal. It's a big problem. Health officials are working really hard trying to get people vaccinated. And if you look at their numbers, they are vaccinating a lot of people right now. So very, very important. If you, another thing you could do to prevent it other than vaccination, which you probably should do, is just good hygiene, hand washing, right? Soap and water. Because the alcohol-based hand sanitizers are not effective at killing the hepatitis A virus. So soap and water, running water, 20 seconds, and particularly before you prepare food or work with food and stuff like that, and definitely after you use the bathroom or change a diaper or anything to that effect. So, yeah, so I just wanted to keep you up to date on what's going on here in the state of Florida. Okay, I got somebody on Facebook Live from California. Hello, Lisa, and I hope you enjoy the show. If you got any questions, bring them on through. Well, the first main topic I want to talk about today is dengue fever, right? And it appears like 2019 is going to be one of them years, right? We see that every few years that dengue really springs up in force. And right here in the Western Hemisphere, there's been over 500,000 cases already, right? About more than 80% are in Brazil alone, and that's typical. That's usually how it is. But overall, we're talking more than 500,000 dengue fever cases in the Americas. So it's really a big problem, and Brazil is the hotbed for that. And I also recently reported on what's going on in Southeast Asia. Last year it was relatively mild, but it's coming back in force. The Philippines and Malaysia, Indonesia, even Singapore is seeing increases in cases. So Vietnam, a lot of cases there. Some of these countries already have over 50,000 cases each. So it's really a problem in Southeast Asia this year. I want to talk a little bit about dengue fever itself, right? So the first confirmed case reports date back to 1789. Of course, dengue fever has been around basically forever, but Benjamin Rush, if you remember back in our American history, who confirmed the first case, and he coined the term breakbone fever because of the different symptoms of muscle aches and joint aches and stuff like that. Well, different authorities, the World Health Organization, the CDC, they say today about 2.5 billion people, or about 40% of the world's population, live in areas where there's risk of dengue transmission. So it is a big problem. And it's seen in more than 100 countries, particularly in Asia, the Pacific, the Americas, Africa, and the Caribbean. So what is dengue? It's a single-stranded RNA-positive RNA-stranded virus. It's a mosquito-borne flavivirus. So it's kind of in the same family as, say, yellow fever or, say, West Nile virus. It's different from Zika in the fact that Zika, there's one serotype that we know of. Well, with dengue, there's at least 4 antigenically different serotypes of the virus. And interestingly enough, I think it was about 5-6 years ago, there was a report in one study that I saw that they discovered a 5th serotype. And that was like the first time they discovered a new serotype in about 50 years. So, but I haven't heard a lot about the 5th serotype in a long time. So if you know anything about that, I'd love to hear more about it. Shoot me a comment, and like to hear more about that. So we have dengue virus 1, 2, 3, and 4, and they cause a wide range of disease in humans. You have what we know is dengue fever, which is typically mild, right? It's typically mild, self-limiting. But then you have the more serious and the life-threatening syndromes we know as dengue hemorrhagic fever and dengue shock syndrome. But these strains are different, but however, they are very, very closely related to each other with about a 60 to 80% homology. There's some slight differences in the surface proteins of the different dengue subtypes. Now, if you get infection to one serotype, say dengue 1, you're going to have lifelong protection against getting infected by it again. And it only gives a very short time cross-protective immunity to the other types. So the first infection is typically minor, right? However, the secondary infections, so if I had dengue 1 and then a year later, 2 years later, I get dengue 2, that can cause very severe disease. And that's where you see the dengue hemorrhagic fever and the dengue shock syndrome, not only in children, but also in adults. And the phenomena that causes this is called antibody-dependent enhancement. So after a person that's infected with dengue, they develop an immune response to that dengue subtype, right? And the immune response produces specific antibodies to that subtype, specific surface proteins that prevents the virus from binding to macrophage cells. However, if another subtype of dengue infects the individual, the virus will activate the immune system to attack as if it was the first subtype. So basically, the immune system is tricked because the 4 subtypes are so similar with their surface antigens. So the immune response will start attracting a lot of macrophages, or these large cells, which the virus proceeds to infect because it's never become inactivated. And that's basically what antibody-dependent enhancement is. And we saw that with the Dengvaxia vaccine, particularly in the Philippines, where you have this big crisis, this debacle where a lot of kids were getting sick and some died. The vaccine itself would act as the first dengue infection, and then they'd get bit by a mosquito with a different serotype, hence they would come down with severe dengue. So very important stuff. Now, regular dengue fever, let me see if anybody's got any questions first. Anything going on? Yeah, Al says dengue hemorrhagic fever is the real bad one. Yeah, it's pretty bad. Dengue shock is also quite fatal, with fatality rates, up in the 30% range when you deal with dengue hemorrhagic fever and dengue shock syndrome. But dengue fever itself will manifest itself with a sudden onset of severe headache and chills and a lot of pain in the eyes, backache, characteristic, pain in the legs and the joints. And that's really where it got its nickname, breakbone fever, or some people have called it bone crusher disease. Yeah, that sounds like something out of the Avengers, right? And this occurs pretty quickly after the illness starts. A rapid temperature rise, sometimes up to 40 degrees C. Some bradycardia, where you have low heart rates, low blood pressure. There's frequently a characteristic rash. And you may have some gastritis with other abdominal pain, vomiting, and diarrhea. The thing with dengue is, because it is relatively mild, it's often misdiagnosed by related diseases, right? Chikungunya, sometimes it's hard to differentiate the two. Chikungunya, which is transmitted by the same Aedes mosquito, is very characteristic for joint pain and stuff like that. Well, so dengue is too, really, in a way. However, stuff like chikungunya, you're not typically going to see a rash. So classic dengue fever lasts, about a week. And other things you may see is the platelet count may drop a little bit until the patient's temperature gets back to normal. So things to look for with dengue fever is the sudden onset of high fever, severe headache, pain behind the eyes, body aches and joint pain, and nausea and vomiting. So, and there's probably a lot of people out there that have had dengue fever. It's a reasonably common thing in many parts of the world. Now, here in the United States, so I'll talk about Florida real quick. Florida itself didn't see any locally transmitted dengue fever for 40 years until 2009, when they saw the first case in 4 decades down in Key West. And since then, we've seen locally transmitted dengue sporadically throughout the state. A couple outbreaks, right? We had an outbreak in 2013. I think it was over there on the East Coast, the Martin County area. Taxing my memory there, but I think I remember that. But I think last year we saw one locally transmitted dengue case all year. So, yeah, so we still see it. But some of these countries are really getting bombarded with dengue. So let's move on to dengue hemorrhagic fever. And it's, of course, the same virus, and it's characterized by increased vascular permeability, abnormal blood clotting, problems like that. And these are deadly complications. The illness often begins with a sudden rise in temperature, flu-like symptoms, a lot of non-specific stuff. But it can continue on, and then convulsions and other complications. Moderate type of dengue hemorrhagic cases, the signs and symptoms will abate after the fever subsides, but in very severe cases, the patient can deteriorate really, really quickly. The temperature drops, followed by signs of circulatory failure. The patient may go into a state of shock, right? And then there's dengue shock syndrome, where it's characterized by bleeding that may appear as tiny spots of blood on the skin. What do we know that as? We know that it's petechiae, and larger patches of blood underneath the skin. And even minor injuries can cause more bleeding, and shock may cause death within 12 to 24 hours. So it's very, very incredibly serious syndrome. But it can be treated with appropriate medical therapies. There's no specific treatment for dengue, but you can treat the symptoms and the different conditions. So what things do we need to look for in recognizing dengue hemorrhagic fever, right? Symptoms are very similar to dengue fever, plus some of the following, right? Severe or continuous pain in the abdomen, bleeding from the nose, the mouth, the gums, right? It's a hemorrhagic fever. Those are some of the symptoms you hear in what other diseases, right? Right, like stuff like Ebola, you may hear of those symptoms. frequent vomiting with or without blood, black stools. When you hear somebody say they had a black stool, that indicates that's blood, right? And it kind of looks, maybe sort of sticky, like coal tar. Pale, cold skin. Then when you're talking about dengue shock syndrome, it's basically dengue hemorrhagic fever plus a very weak, rapid pulse, cold, clammy skin and restlessness. And and both of those are considered life-threatening. Let me see if there's anybody on the board that wants to chime in on dengue fever, and nobody does. Now, the diagnosis of dengue is typically done clinically. There are testing for that, of course. There's PCR and all that, but typically it's based on the symptoms. And typically the diagnosis is a diagnosis of exclusion, right? You have a lot of diseases that are going to have a lot of these nonspecific symptoms early on. The flu is a great example. A lot of those symptoms early on in dengue fever are very much flu-like. So it's really important for the physicians to detect the severe forms of dengue fever, right? The hemorrhagic fever and shock syndrome. And there's some laboratory tests out there that can be used to help in the evaluation of dengue hemorrhagic fever or dengue shock syndrome. The total white blood cell count. The test will essentially show leukopenia, a decrease, right? Now, but this can also be seen in other conditions, right? Leptospirosis, septicemia. So other conditions, you may also see the white count at such levels. Thrombocytopenia, right? A decrease in the platelet count. And this is, again, very, very important. And low platelet counts are pretty suggestive of dengue fever if you have it for, several days. Again, this symptom is also seen in other diseases, right? Leptospirosis and measles and rubella, meningococcal blood infections and the like. And the hematocrit, right? The hematocrit is just like the packed RBCs as a percentage compared to the RBCs plus the plasma. And so those are tests that you might want to look at if you're trying to try to diagnose whether it could be severe dengue. Now, things you should avoid if you're talking about dengue fever, right? You shouldn't be treating the fever with aspirin or ibuprofen or other non-steroidal anti-inflammatories, because what will they do? They'll make the bleeding even worse, right? Tylenol is acceptable, though. Tylenol is just fine. So, all right. I think I'm going to go ahead and shut down dengue fever and go on to the topic of the year so far in the U.S., and that's the measles situation. But I want to look at it from a different angle, and I want to look at it from the cost, right? There's obviously a human cost. There's this illness cost. Fortunately, we haven't seen any fatalities in this country. But believe me, I think the Philippines reported over 400 fatalities this year. Madagascar is like over 1,000. So, I mean, there's a lot of people dying over this stuff. Ukraine has been reporting fatalities. But then there's an economic cost. And to understand how measles is, it's just highly, highly contagious, and it requires a lot of contact tracing and finding people who may have been exposed. So you're talking about personnel time and epidemiologists out there, shoe leather epidemiology, getting around there, trying to locate these people. So, and all this becomes very, very expensive, and particularly in staff and personnel time. Let me go ahead and start out and play a short audio. The Detroit, Michigan area, they've had, more than 40 cases so far. And up in Oakland County, the public health department up there, they've spent some money in just the past month. So, right, their outbreak's been going on for a month now. So let's go ahead and listen to clip number 1, Michael.
We're learning that the measles outbreak has cost Oakland County an alarming amount of money. Health officials confirm that at least $200,000 has been spent so far. That money spent hiring around-the-clock staff to respond to potential measles cases and potential exposure, answering questions about the measles and to hold vaccination clinics. This is the worst measles outbreak in Michigan since 1991.
Yeah, so that's pretty expensive for 1 month's worth of work, and you're talking about a lot of epidemiology work going on there. Now, I'll go back to dengue real quick. I see that Tho Lee asked about dengue 5, and that is actually a question I asked the beginning of the show. I don't know, 2013, 2014, somewhere around that time, they discovered a dengue serotype 5, and haven't heard much about it lately. So that's really what I was asking the audience. If anybody knows much about it, I would love to hear more. And then Al Rubenstein, he's asking about co-infections. Yeah, you can find co-infections with dengue and chikungunya and Zika. You can be co-infected with all. Much like with the tick-borne infections, right? You have people that are co-infected with Lyme, Babesia, anaplasmosis. Yeah, so that all does happen. But let me go ahead and jump back to the measles and the cost of measles, because this is not cheap, right? Several months ago, we saw that report on MMWR about the case of the child in Oregon in the U.S. who contracted tetanus. His parents never got him vaccinated, and he came down with tetanus, and it wasn't so much the epidemiology cost, but it was the absolute medical cost. In his case, it was almost more than $800,000 in medical bills. And a lot of that was in the ICU, so very expensive stuff. Well, measles, there's hospital costs to go along with measles also, but a lot of it is just the public health costs that go along with it. Now, Clark County, that's up in Vancouver, Washington, in the Pacific Northwest of the United States. After 4 months, they finally declared their measles outbreak over, right? They finally went 6 weeks without any new cases, and they ended up with this outbreak that started January 3rd, 71 cases. More than 230 people worked on the incident. Tons of public health staff, other Washington Department of Health staff, Medical Reserve Corps, CDC people came up there to help out. And the different responders worked more than 19,000 hours on the measles outbreak, with public health staff clocking in almost 13,000 hours on the outbreak. Public health total cost for the outbreak is, get this, $864,679. And of that total cost, the staffing accounted for the most by far. It was over $600,000 for public health staff to do their job. Now, could that money be used for something better, right? Something different? That's a lot of money. And if I recall correctly, the initial case was a travel associated case, somebody that came back from the Ukraine, and that's how the outbreak started in that part of the United States. So yeah, very expensive stuff. Let's see if we got any questions. Yeah. So Al did find a case where there was actually a co-infection with dengue, chikungunya, and Zika. So yeah, it is totally possible. Totally possible. Okay, I'm getting close to the break. I want to encourage you to check out the website. That's outbreaknewstoday.com, outbreaknewstoday.com. I also have a podcast. You can find that on Apple Podcasts, Stitcher Radio, and Spotify. That's called Outbreak News Interviews. Okay, after the break, more about measles.
Welcome back to Outbreak News This Week, your source for all the news about worms and germs. Here's your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, welcome back to the program. And I am on Facebook Live today, and I thank you for watching. And just to close out the situation with the measles talk that we've done so far today, I want to go ahead and play a short 2-minute clip concerning the cost. Right, this is from CNBC. It's a business station on TV in the U.S. And the director of the NIH, his name is Dr. Anthony Fauci, is being asked about the cost of measles. Let's hear what he has to say. Clip number 2, Mike.
It's hard to put a number on some of these things, particularly when you're talking about a disease that kills. But UNC did a study and found that vaccine-preventable diseases cost the economy about $9 billion several years ago.
Right.
And if you look at the CDC, they said back in 2013 that every measles case that is hospitalized runs up a tab somewhere between $4,000 and $46,000. Those are dollars that could be spent elsewhere. What are your concerns from an economic perspective?
Well, I think that if you wind up getting more infections and diseases that were vaccine preventable, those are entirely avoidable burdens on the economy. Because when people get sick, they lose work, they lose the finances from work, they have hospital costs, they have direct and indirect costs. These are completely avoidable, and it's really a shame that in the 21st century, in 2019, when you have vaccine-avoidable diseases, that we're not getting vaccinated and essentially putting those diseases to rest like we did with measles in 2000, and unfortunately, it's creeping back on us.
What advice would you give to industries like the airlines in terms of protecting their employees, protecting their passengers?
Well, I think what they need to do, particularly, and several airlines are already doing that, to make sure they go back and check the vaccine status of their employees, of their flight attendants, of their pilots, to make sure they're fully protected.
Are there other areas of the economy, other industries that you think about in a situation like this?
No, I think you pointed them out. I think it's important, travel industries, because people are afraid when they go into a closed place that there is a person, for example, on a plane that might be infected, that you can actually transmit it to the people. One of the problems with measles, unfortunately, on the one hand, measles is one of the most transmissible viruses that we know. And on the other hand, the vaccine for measles is one of the most effective vaccines that we know.
Yeah, so that's Dr. Anthony Fauci. So we're elaborating on the cost, and he also elaborated a lot on the contagiousness of measles. Right? I think what does it have, a R null of 18 or something like that. So, if there's one person comes in that's infected and you have a susceptible population of 20 people, at least 18 of those people are going to catch measles. That's how contagious it is. I mean, you can compare that to the flu, and flu is like, I don't know, it has an RO of 3 or 4 or 5, something like that. So it's way more contagious than the flu. So just concerning the measles outbreak in the U.S., just to give you some numbers, right? There's been 704 cases as of April 26th. And that's the most in any year since 1994, right? 1994. Here we are in 2019, and we've seen the most measles cases in all those years, like 25 years. And the highest number recorded since the virus was effectively eliminated in 2000. So, and a good portion, 7 out of 10 were fully unvaccinated, and it doesn't really say what the status was of the others. I'm sure there's some undervaccinated and some undetermined cases out there also. And then I just want to talk about some of the craziness that goes on in our politics here in the U.S. And there's a senator from Keithville, Louisiana, and he was on the Senate floor in Louisiana the other day. His name is Senator John Milkovich. Yeah, they describe him as a Keithville Democrat. And he was on the Senate floor assailing vaccines. He was saying they were unsafe and was repeating claims that a number of studies have already discredited and debunked. Milkovich claimed autism did not exist when he was growing up and that the tissue was from aborted babies is now used in vaccines. He also suggested aluminum and mercury in vaccines are dangerous. Well, a lot of that stuff has been debunked, right? How many studies has there been, epidemiological studies that have shown that autism is not caused by vaccines? They had one earlier, I think it was earlier this year, from Denmark, or one of the Scandinavian countries, and they had, they looked at a population of 650,000 people. I mean, and they determined, nay, it is not the cause of autism. And a lot of the studies coming out now are showing that it sure looks like autism is due to something that happens prenatally. So it's really hard to blame it on the vaccine. Even though Andrew Wakefield, who put out that horrible study back in 1998, that put such a stain on the MMR vaccine, and we haven't been able to dig ourselves out of it. And it's just totally a shame, because all this stuff is really unnecessary. And also, there's been studies that talk about the aluminum and mercury, thimerosal in the vaccines, and no real harm to human beings. Now, concerning the aborted fetal tissue, I actually did write an article on one of our sister websites some time ago on the Global Dispatch. That was in 2017, actually, about the aborted tissue used to make that first vaccine. And as a Christian, what should you say about that? What should you do about it? Well, this is a quote from the Ethics and Religious Liberty Commission of the Southern Baptist Convention. And they're saying, knowing that these vaccines are safe and have saved millions of lives through their use, what are we to do with the history of how they were manufactured? Clearly, the process by which these vaccines are made are not ethically ideal. Therefore, we should continue to advocate for use of alternatives when available and for the development of future vaccines to be carried out by other means. The key consideration in whether using currently available vaccines is licit or immoral is whether there is a material cooperation with the evil act of abortion. If the abortion was conducted in order to harvest tissues that were used to make the vaccine, then they say it would be clearly immoral. But in the case of the vaccines listed above, the abortion was carried out for other reasons and the tissue was acquired post-mortem for the purpose of medical research. So essentially what they're saying is, this is not a perfect world. However, how many lives are being saved from this aborted tissue from the 1960s? There hasn't been any other aborted tissue used to make vaccines. It's been, harvested over and over. The cells. So, that's one way to look at it if that is a concern of yours. Let's look at Paco put a comment up there. How unfortunately it's in Spanish, so I can't really read it. Dawn, wondering if someone dies with a disease like this lady they unearthed who had smallpox, how long before the body will not contaminate others? Good question. Since they are viruses, I don't know where they buried her up from. If it was able to keep the virus viable, was it, in the under extremely ice cold tundra or something like that? I mean, because as soon as the cells are dead, the viruses need cells to multiply and divide. So I'm not really sure how long that would take for it to be totally gone. If anybody out there knows, I would love to hear from it. Okay, let's get away from measles for a little bit. And it's the beginning of May, right? And May is Lyme Disease Awareness Month in the United States. So So I'll be doing a lot of podcast interviews this month, I'm sure, on Lyme disease. I did one on Wednesday concerning a 3-antibiotic cocktail used to treat the Lyme disease persistiforms. And you could find that podcast on outbreaknewstoday.com or on Outbreak News interviews on Apple Podcasts, Stitcher Radio, and Spotify. And I'll be doing more Lyme disease podcasts this month since it is Lyme Disease Awareness Month. So Johns Hopkins, the Lyme Disease Research Center at Johns Hopkins I think that's up in Baltimore, they asked these questions. Are you aware of these important facts? Lyme disease is a bacterial infection caused by a spirochete, Borrelia burgdorferi, which is transmitted through the bite of an infected deer tick. I think most of us know that. Lyme disease is the fastest growing and highest incident vector-borne illness in the U.S., over 300,000 new cases each year. That's an estimate that came out, I don't know, the CDC put out that estimate, I think in 2013. I've seen more recent estimates that are saying it's probably more like 450,000 cases each year. But don't quote me on that one. Misdiagnosis and delayed diagnosis can lead to protracted and debilitating disease. It's May, right? May, June, July, and August are the highest incident months, but you can contract Lyme disease year-round, particularly in more temperate regions such as Northern California. Getting bitten by an infected deer tick can have serious, long-lasting multi-system health implications. They say like musculoskeletal, heart, brain, and nervous system impairment. So how can you enjoy the outdoors more safely? They ask. It's really, really important. I mean, that's really the prevention, right? Is not getting bit by a tick. And if you go to the website, I have plenty of interviews and articles concerning ticks and safety against tick-borne disease and the risk. So the people up at Hopkins says, when outside, wear protective clothing treated with tick pesticides such as permethrin. Research and use suitable tick repellent products on your skin. Stay on marked trails and off the tall grass and leaf litter. Create a tick-free zone around your house. Perform daily tick checks, especially after coming in from the out of doors and showering. And that's really interesting because I did an interview with Dan, the Tick Man Wolf, and that's what he does. He makes products for removing ticks from your body, and he's been working on ticks for a long, long time. And he, during a talk I had with him, he came on the show and said, I mean, when he goes in the shower, he checks everything, even like the groin, anywhere that a tick can hide, the top of the head, in the hair, all kinds of stuff. So, I mean, so it's really important to do a good examination of yourself, particularly if you've been outdoors among tall grass and the woods and that kind of stuff. Remove ticks once found immediately by grasping with a tweezer and pulling them straight off the skin without twisting. Right, you don't want to leave the mouth parts in. You want to just pull that out, pull that thing out cleanly. Put your clothes in a dryer on high heat for 15 minutes after being outside. So if there's ticks hiding out in there, that'll kill them. And if a rash appears, which they don't, I've seen different percentages where the EM rash, some people say up to 70% of the time. That's that bullseye rash if you've never seen it before, and some say much lower than 50%. So I'm not sure what the true number is. Every expert has their own number, I guess. But if you do see a rash, that's a really, really good indicator. So definitely go see your doctor pretty quickly. So just glad to share some stuff about Lyme Disease Awareness Month, and we'll be hearing more about that here on the show. Denver, Colorado. Let me check for messages first. Okay, Dawn translated. I see. Okay. Denver, Colorado. Well, April was STD Awareness Month, and There was a lot of news about the increases in sexually transmitted diseases or sexually transmitted infections, how it's more commonly called these days, in the United States and elsewhere. I mean, every day I'm putting up reports about, increases in syphilis here, increases in gonorrhea there. I mean, it's just definitely a serious problem. In Denver, Colorado, they've reported quite a sharp increase in certain of the STDs, right? Gonorrhea cases in Denver, Colorado have grown by 150% in the past 4 years. And what they're seeing the gonorrhea cases in both men and women with the highest increases in the Latino population. Syphilis cases are up 75% in the last 4 years. And again, a lot of that is being seen in different communities of color, which are seeing a twofold increase in syphilis cases. So what the health officials in Denver are saying is, while there's several factors linked to these increases in STDs, for some reason, the decrease in condom use is going on. And that's where they're really pointing their fingers at. And so what Denver's doing and what cities all over the country are doing is they're encouraging people to get tested. It's easy to get tested. And for these three diseases, it's still easy to treat. Gonorrhea is getting a little tougher, but syphilis and chlamydia are still pretty easy to treat, right? So, yeah, you definitely want to get that checked out if you think you may have been infected. Then there's the other story that I've been covering over past couple years, at least here in the U.S., is this increase, and this is so preventable and so sad, is the increase in congenital syphilis cases. Last year, I don't know, Arizona saw like 45 or 50 cases. And congenital syphilis is essentially syphilis in the fetus or in the infant at birth. And it's very, very devastating. It can cause, of course, miscarriage and stillbirth, right? And if the child does survive, we're talking about premature birth and birth defects and just all kinds of horrible things, bone deformities and situations with the eye. And it's just a horrible, horrible thing. And it's totally preventable. Well, the Minnesota health officials, like most other states, are seeing an increase. And in 2018, they saw 10 congenital syphilis cases. And to put that into perspective, oh, no, it's only 10. Well, they only saw 2 in 2017. And, you're talking about, what was that, a 400% increase? So it's dramatic. It's really dramatic. And all it really takes is, to prevent it is getting tested. And a lot of health departments now are wanting you to get tested, the pregnant women in particular, a little bit later too, because some people are contracting syphilis after their first test and contracting it then. So, but yeah, just a horribly, horribly sad story coming out of Minnesota with the syphilis, congenital syphilis. That just absolutely breaks my heart. Okay, let me go to Facebook real quick. And no new comments. All right, Ebola. Ebola is something that we cover pretty frequently. And what we're seeing right now in the Democratic Republic of the Congo is incredibly unique. Now, you're not seeing the numbers yet. Let's hope not, that we saw in the West Africa outbreak in 2014, 2016. However, they're dealing with situations that you didn't see in the West Africa outbreak. Now, in West Africa, I don't think they've ever experienced Ebola prior to, the end of 2013, early 2014. And you're talking about a lot of movement of people from city to city to city in those three countries, Liberia, Guinea, and Sierra Leone. So not a whole big surprise that it got so big, right? DRC has seen a lot of Ebola outbreaks. I think this is the 10th one so far since the initial one back in 1976. But the thing that's unique about this is they're really dealing with a lot of violence. Horrible, horrible stuff, right? You got a lot of armed gangs and maybe terrorists. A lot of violence going on there, and it's a lot of risk for the Ebola workers that are there. And I think it was just a week or two ago they reported on some epidemiologist from another African country that was there helping out was shot. So just a total shame. But what they're seeing, though, is just in April, right? We just passed April, and the DRC, this outbreak, which is in the North Kivu province, Ituro provinces in the northern part of DRC, they saw the deadliest month in April, right? When did the outbreak start? Last August, I think it was. Yeah. They saw over 300 fatalities just in April alone. So, yeah, that's huge. So it looks like it's getting worse. I'm going to look at an article from our good friends over at CIDRAP, right? I encourage you to check them out too, cidrap.umn.edu. Great reporters over there. And the latest numbers we got on that is, overall, more than 1,500 Ebola virus disease cases have been reported in DRC. It just went over. So it's at 1,510 when they just had 15 more confirmed cases yesterday. So, and the total fatality rate is getting very close to 1,000. So, that's huge. So what kind of case fatality rate are we dealing with here? It's in the 60s, 60 to 70%. So talking about a very serious outbreak, and they're really struggling with a lot of different issues there, in particular the violence. So got to keep an eye on that and pray for these people because they definitely need it. The dengue vaccine, Dengvaxia. We touched on this earlier in the show, and I think it was Wednesday, the U.S. Food and Drug Administration announced the approval of Dengvaxia. Now, like 19 other countries, 20 countries or so have already approved it, something like that. The U.S. has finally done it, but it's only approved for very specific reasons. It's for places where it's endemic. And the only places that are dengue's endemic are some of the U.S. territories, right? Puerto Rico and American Samoa and the U.S. Virgin Islands and the like. So, yeah, that finally got approved here. And they're putting down some pretty specific rules about... Okay, it says Dengvaxia is not approved for the use in individuals not previously infected by any dengue virus serotype, or for whom this information is unknown. This is because in people who have not been infected with dengue virus, Dengvaxia appears to act like a first dengue infection without actually infecting the person with wild-type dengue virus, such that a subsequent infection can result in severe dengue disease. And we kind of talked about that. Well, not kind of. We did talk about this a little bit earlier. So they're saying, therefore, healthcare professionals should evaluate individuals for prior dengue infection to avoid vaccinating individuals who have not been previously infected with dengue virus. And this can be assessed through medical records of a previous laboratory confirmed dengue infection, serological testing, and stuff like that prior to vaccination. So, yes. So I'm surprised to see that. So you see that being approved here. You see the Philippines getting rid of it, suing Sanofi. So it's a mixed bag. Okay, I'm out of time. I will see you next week on Outbreak News This Week. Good day. God bless.
Thank you for listening to Outbreak News This Week with Robert Harriman. If you missed any part of today's program, you can listen to the podcast anytime on our website, outbreaknewstoday.com. Make sure to join us here next week for Outbreak News This Week with Robert Harriman.